Right now, inside every artery in your body, there is a layer of cells so thin you could barely see it under a microscope. It's called the endothelium. It's only one cell thick, and it's the single most important tissue in your entire cardiovascular system. When this layer is healthy, it keeps your arteries relaxed, flexible, and resistant to plaque. It prevents blood clots from forming where they shouldn't. It regulates how much blood flows to your brain, your heart, your kidneys, and every organ that keeps you alive. It does all of this silently, every second of every day, without you feeling a thing. And when it's damaged, it does something far worse. It starts the process that leads to heart attacks, strokes, kidney failure, and vascular dementia. Not in weeks or months, over years, over decades, silently, invisibly, without producing a single symptom you'd recognize as a heart problem until the damage is advanced enough to cause a crisis. The silent heart risk that most people never notice isn't high cholesterol. It isn't high blood pressure. Those are consequences. The root cause, the first domino that falls in the chain of cardiovascular disease, is endothelial dysfunction. It's the disease before the disease. And right now, it's happening inside millions of people who believe their heart health is fine because their cholesterol panel came back within range and their blood pressure is being managed. In this video, I'm going to explain what endothelial dysfunction actually is, why it's the real starting point of cardiovascular disease, why standard health checks miss it entirely, and what you can do to detect and reverse it before it becomes the heart attack that nobody saw coming. Hi, I'm Dr. Alex. I'm an emergency medicine doctor, and after nearly a decade in the AANNEE, I've seen the end of the story that endothelial dysfunction writes. I've seen the 52-year-old whose first symptom of heart disease was a cardiac arrest in a car park. I've seen the 58-year-old woman whose stroke destroyed her ability to speak, who had passed every routine health check for the previous 15 years. I've seen widowmaker blockages, ruptured plaques, and sudden deaths in people who had no idea anything was wrong. And what I've learned from all of it is that cardiovascular disease doesn't begin when you feel something. It begins in the endothelium, years or decades before. My goal now is to close the gap between what the science knows about cardiovascular risk and what the public is actually being told. Before we go further, I want to make you a promise. I promise to keep creating the most useful, evidence-grounded videos I can to help you protect your health and live a longer, stronger life. All I ask is that you give this channel a chance and hit the subscribe button. If you get to the end of this video and feel it wasn't worth your time, unsubscribe, no hard feelings. But if this changes how you think about your heart, subscribing helps me reach more people who need to hear it. So please take a second, hit subscribe, and let's get into this. The endothelium, the organ you've never heard of. To understand why endothelial dysfunction is the real starting point of heart disease, you first need to understand what the endothelium actually is and what it does. Because it's not just a passive lining, it's the largest organ in your body that nobody talks about. If you were to lay out every endothelial cell in your body flat, it would cover the area of roughly 6 tennis courts. This single cell layer lines every blood vessel, from the largest artery to the smallest capillary, and it performs 4 critical functions that determine whether your cardiovascular system thrives or deteriorates. The first function is vascular tone regulation. The endothelium produces a molecule called nitric oxide, which is the master regulator of blood vessel relaxation. When nitric oxide is abundant, arteries stay relaxed, flexible, and wide. Blood flows freely, pressure stays low. When nitric oxide production declines, arteries stiffen and constrict, blood pressure rises, and the heart has to work harder with every single beat. This is not just a contributing factor to hypertension. In many cases, it is the primary cause. The second function is antithrombotic protection. A healthy endothelium actively prevents blood clots from forming on the vessel wall. It produces substances like prostacyclin and tissue plasminogen activator that keep platelets from aggregating where they shouldn't. When the endothelium is damaged, this protective coating is lost. The inner surface of the artery becomes sticky, prothrombotic, and vulnerable to the clot formation that causes heart attacks and strokes. The third function is barrier control. The endothelium determines what enters the arterial wall from the bloodstream and what stays out. In a healthy state, it selectively admits nutrients and oxygen while excluding LDL cholesterol particles and inflammatory cells. When the endothelium becomes dysfunctional, this selectivity breaks down. LDL particles penetrate the arterial wall, white blood cells follow, and the process of atherosclerotic plaque formation begins. Without endothelial damage, cholesterol alone cannot form a dangerous plaque. The endothelium is the gatekeeper, and when the gate breaks, the invaders pour through. The fourth function is inflammatory regulation. The endothelium controls the expression of adhesion molecules on its surface that determine whether immune cells stick to the vessel wall and migrate into the tissue beneath. In a healthy state, these adhesion molecules are kept at a minimum. When the endothelium is activated by oxidative stress, high blood sugar, chronic inflammation, or elevated blood pressure, it upregulates these molecules, essentially putting up a welcome sign for inflammatory cells that drive plaque development. Why this changes everything you thought about heart disease. Now, here's where the standard understanding of heart disease falls apart. For decades, the public message has been centered on cholesterol. Get your LDL down and your heart will be safe. And cholesterol management does matter, but it's not the beginning of the story, it's the middle. The story begins with endothelial damage. Something harms the lining of your artery, that something could be chronically elevated blood sugar, which glycates the endothelial surface proteins and impairs nitric oxide production. It could be high blood pressure, which creates excessive shear stress that physically injures the endothelial cells. It could be chronic inflammation driven by visceral fat, a damaged gut, or an ultra-processed diet, which activates the endothelium and turns it from a protective barrier into an inflammatory surface. It could be cigarette smoke, which is directly toxic to endothelial cells. Or it could be insulin resistance, which impairs the signaling pathways that produce nitric oxide. Once the endothelium is damaged, the cascade begins. Nitric oxide drops, the artery stiffens, LDL particles penetrate the wall. They become oxidized, immune cells are recruited, foam cells form, fatty streaks develop. And over years, those streaks mature into the fibrous calcified plaques that narrow arteries, and when they rupture, trigger the blood clots that cause heart attacks and strokes. Research published in the Journal of the American College of Cardiology has established that endothelial dysfunction is detectable years to decades before clinical cardiovascular events, and that it is a stronger predictor of future heart attacks than LDL cholesterol levels alone. A study published in Circulation demonstrated that patients with endothelial dysfunction had nearly 3 times the rate of cardiovascular events compared to those with normal endothelial function, independent of traditional risk factors. And here's the fact that should stop you in your tracks. Up to 50% of heart attacks occur in people with normal or near normal LDL cholesterol. Their cholesterol wasn't the primary problem, their endothelium was. The lining failed first. The cholesterol simply took advantage of the broken gate. What destroys the endothelium? Understanding the causes of endothelial damage makes the entire cardiovascular picture much clearer, because every major risk factor for heart disease converges on the same target. Insulin resistance is arguably the most destructive and most underappreciated driver. Chronically elevated insulin impairs the endothelial nitric oxide synthase pathway, the enzyme system that produces nitric oxide. Research published in Diabetes has shown that insulin-resistant individuals produce up to 40% less endothelial nitric oxide than insulin-sensitive controls. This means your arteries are stiffer, less protected, and more vulnerable to plaque formation long before your blood sugar reaches diabetic levels. Chronic inflammation is the second major driver. Inflammatory cytokines, particularly interleukin-6 and C-reactive protein, directly activate the endothelium and upregulate the adhesion molecules that invite immune cells into the arterial wall. Visceral fat is the primary factory for these cytokines, which is why waist circumference is now considered a more meaningful cardiovascular risk marker than BMI. Oxidative stress is the third driver. When the balance between reactive oxygen species and antioxidant defenses tips in the wrong direction, nitric oxide is rapidly destroyed by superoxide radicals before it can do its job. Smoking, processed food diets, excess alcohol, and environmental toxins all increase oxidative burden and degrade endothelial function. High blood pressure is both a cause and a consequence of endothelial damage. Elevated pressure physically injures endothelial cells, particularly at arterial branch points where turbulent flow creates mechanical stress. The injured endothelium produces less nitric oxide, which allows blood pressure to climb further, creating a self-perpetuating cycle. And poor sleep compounds all of these. Research published in the European Heart Journal has shown that chronic sleep deprivation impairs endothelial function directly and independently of other risk factors. Even a single week of sleeping less than 6 hours per night produces measurable endothelial damage. Now, before we get into what you can do about this, if you're finding this valuable, hit the like button. It takes 2 seconds and it genuinely helps this reach more people who need to hear it. And if you haven't subscribed yet, now's the time. We're about to get into the part that could change the trajectory of your cardiovascular health. Let's keep going. So now you understand the mechanism, and here's the insight I want you to carry with you for the rest of your life. The mistake most people make with heart health is managing downstream numbers while ignoring the upstream cause. They take a statin to lower their LDL. They take a blood pressure medication to control their numbers. And both of those things are important and can save lives. But if nobody addresses the endothelial dysfunction that started the process, the disease continues to progress beneath the medication. The plaque keeps forming, the arteries keep stiffening, the nitric oxide keeps declining, and one day, despite the controlled cholesterol and the managed blood pressure, a plaque ruptures and a clot forms, and everyone says it came out of nowhere. This is what I call the downstream treatment trap. The entire cardiovascular risk model that most people live under is built around measuring cholesterol and blood pressure and treating them when they cross a threshold. But those measurements don't tell you whether your endothelium is functional. They don't measure nitric oxide availability, they don't assess arterial stiffness, they don't detect the inflammatory activation of the vessel wall that precedes every plaque. The model catches the consequences, it misses the cause. And this is not your fault. Endothelial function testing exists. It's been validated in research for over 30 years, but it's not part of routine screening in primary care anywhere in the world. Your GP doesn't have the tools or the time to measure it. The health system is built around acute intervention, statins when cholesterol is high, antihypertensives when pressure is elevated, stents and bypasses when arteries are blocked. It's extraordinarily good at managing the crisis, it's poorly equipped to prevent it. Meanwhile, the modern lifestyle is conducting a relentless assault on your endothelium. Processed food drives insulin resistance and inflammation. Sedentary living deprives the endothelium of the sheer stress it needs to produce nitric oxide. Chronic stress elevates cortisol and blood sugar simultaneously. Disrupted sleep impairs endothelial repair, and the environmental toxins in the air, water, and food supply generate the oxidative stress that degrades nitric oxide before it can protect you. Your endothelium has been under attack for years, and nobody checked. I'm not going to tell you to stop taking your medication. I'm not going to suggest that lifestyle changes replace statins or blood pressure drugs. What I am going to give you are the 5 interventions that directly restore and protect the endothelium, the actual tissue where cardiovascular disease begins. These work alongside your medication, and they address the root cause that medication alone does not. The first and single most powerful intervention is regular aerobic exercise. When you walk, run, cycle, swim, or do any sustained physical activity, the blood flowing through your arteries creates a physical force on the endothelial surface called laminar shear stress. This mechanical stimulus is the most potent natural activator of endothelial nitric oxide synthase, the enzyme that produces the nitric oxide your arteries desperately need. Research published in the Journal of the American College of Cardiology demonstrated that consistent moderate aerobic exercise improves endothelial function by 25 to 30% within 8 weeks. Nothing else, no drug, no supplement, no dietary change produces an improvement of that magnitude in that time frame. Exercise doesn't just lower your risk factors, it physically repairs the tissue where the disease starts. The second intervention is an anti-inflammatory, nitric oxide supporting diet. Leafy green vegetables, particularly spinach, rocket and beetroot, are rich in dietary nitrates that your body converts directly into nitric oxide through a pathway that bypasses the endothelial enzyme system entirely. This means you can increase nitric oxide availability even if your endothelium is already impaired. Oily fish provides omega-3 fatty acids that reduce endothelial inflammation. Extra virgin olive oil contains polyphenols that protect nitric oxide from oxidative destruction. And dark chocolate, in moderation, contains flavonols that directly stimulate endothelial nitric oxide production. Research published in the New England Journal of Medicine demonstrated that a Mediterranean dietary pattern reduced cardiovascular events by approximately 30%, and subsequent analysis attributed much of this benefit to improved endothelial function. The third intervention is addressing insulin resistance directly. Since insulin resistance is one of the most potent destroyers of endothelial function, improving insulin sensitivity restores nitric oxide production at the enzymatic level. Reducing refined carbohydrates and added sugars, increasing dietary fiber, walking after meals, and maintaining a healthy body composition all improve insulin sensitivity. Remember what I said earlier, insulin-resistant individuals produce up to 40% less endothelial nitric oxide. Reversing that resistance reclaims that nitric oxide. Your arteries become more relaxed, more flexible, and more resistant to plaque formation. The fourth intervention is optimizing sleep. During deep sleep, the endothelium undergoes repair, damaged endothelial cells are replaced, nitric oxide synthase activity is restored, and the oxidative damage accumulated during the day is neutralized. When sleep is disrupted or insufficient, this repair window closes. Research published in the European Heart Journal demonstrated that people who consistently sleep fewer than 6 hours have significantly impaired endothelial function compared to those sleeping 7 to 8 hours, even after adjusting for all other risk factors. Protecting your sleep is protecting the lining of every artery in your body. The fifth intervention is knowing your numbers beyond LDL cholesterol. Ask your doctor for an hsCRP test, which measures the inflammation that activates the endothelium. Ask about apolipoprotein B, which tells you how many atherogenic particles are actually circulating, not just how much cholesterol they carry. Discuss whether a coronary artery calcium score might be appropriate, which directly visualizes the plaque that endothelial dysfunction has already produced. And ask about your fasting insulin level, which will tell you whether insulin resistance is silently degrading your nitric oxide production. These tests don't replace standard cholesterol screening. They complete the picture that standard screening leaves unfinished. And a critical caveat: if you are currently on any medication for blood pressure, cholesterol, blood sugar, or any other cardiovascular condition, do not stop or change it based on this video. Statins, in addition to lowering cholesterol, have anti-inflammatory and endothelial protective effects that are independently beneficial. Blood pressure medications reduce the mechanical stress on the endothelium. These drugs save lives. What I'm sharing here is the biological foundation that makes them work better and addresses the root cause they weren't designed to fix on their own. In the emergency department, I have never seen endothelial dysfunction on a whiteboard. I've never had a patient referred to me with a diagnosis of impaired nitric oxide production. What I see is the final act of a play that started 20 or 30 years earlier in the endothelium. I see the 54-year-old businessman whose first symptom was a massive anterior ST elevation myocardial infarction. His cholesterol had been managed, his blood pressure was controlled, nobody had measured his endothelial function, his insulin level, his hsCRP, or his arterial stiffness. The disease had been progressing silently for 2 decades while the downstream numbers looked acceptable. I see the 61-year-old woman whose transient ischemic attack was the first sign that the carotid arteries feeding her brain were narrowed by plaque that had built up behind a dysfunctional endothelium nobody assessed. But I've also seen patients who changed course, patients who started exercising, who transformed their diets, who addressed their insulin resistance, who fixed their sleep, who came back with arterial stiffness measurements that had improved with hsCRP levels that had dropped, and with coronary calcium scores that had stabilized rather than progressed. The endothelium responds. When you remove the insults and provide the right stimuli, it produces more nitric oxide, it regains its barrier function, and it stops inviting the inflammatory process that builds plaques. The window to intervene is long, but it doesn't stay open forever, and the people who act while the endothelium can still recover are the ones I don't see in the emergency department. This video was about one thing, the single most important tissue in your cardiovascular system that nobody has told you about, a layer of cells so thin you can barely see it, yet so consequential that its health determines whether your arteries stay open or close, whether your blood pressure stays manageable or climbs relentlessly, whether your brain receives the blood it needs to keep you sharp, and whether the heart that has been beating without rest since before you were born can continue to do so for decades to come. Heart disease is not an event, it's a process, and that process starts in the endothelium. By the time you feel something, by the time the chest tightens, by the time the arm goes numb, by the time the breathlessness stops you on the stairs, the process has been running for years. The time to act is not when the symptoms arrive. The time to act is now. While the endothelium can still be repaired, while the nitric oxide can still be restored, while the arteries are still flexible enough to respond. Your heart doesn't ask for much. It asks for movement, real food, restorative sleep, and the absence of the metabolic insults that modern life delivers by default. Give it those things, and the endothelium holds. The arteries stay open, and the crisis that I see every week in the emergency department never arrives. So let's bring it together. The silent heart risk most people never notice is endothelial dysfunction, the breakdown of the single cell lining inside every artery in your body. When this lining is healthy, it produces nitric oxide that keeps arteries relaxed, prevents clots, blocks plaque formation, and controls inflammation. When it's damaged by insulin resistance, chronic inflammation, high blood pressure, oxidative stress, and poor sleep, every step in the cascade of cardiovascular disease begins, and standard health checks don't measure it. The solution is regular aerobic exercise that physically restores nitric oxide production, an anti-inflammatory diet rich in nitrate-containing greens and omega-3 fatty acids, reversing insulin resistance through dietary and lifestyle changes, protecting deep sleep, and requesting advanced cardiovascular testing that looks beyond cholesterol alone. 5 interventions that target the root cause of heart disease, not just the downstream consequences. If this video changed how you think about your heart, please subscribe to this channel. I make these videos because I believe the information that saves lives should be available to everyone, explained clearly and grounded in real science. Subscribe, share this with someone whose heart matters to you, and I'll see you in the next one.